Hi again, Daniel here. We've previously mentioned the World Health Organization's Mental Health Action Plan, and this video is going to extremely briefly cover what it is and what it plans to do. Adopted in May of 2013, the Mental Health Action Plan aims to promote mental well-being and human rights, reduce mortality, morbidity, and disability resulting from mental illness, both through reactive and proactive measures. To this end, it is guided by the following 6 principles. Provision of health and social services to anyone regardless of age, gender, race, or any other devices. Ensuring that fundamental human rights are not violated. Basing strategies on scientific evidence accounting for socio-cultural differences. Shifting the breadth of services to accommodate all stages of life. Collaboration between multiple public and private sectors of society, such as education, health, and social sectors. The empowerment and involvement of people suffering from mental illnesses by engaging them in aspects of mental health strategies. The plan itself has 4 objectives shown here, which will be the primary focus of this video. The full list of proposed actions, which is by no means complete and or exclusive to other ideas, can be found in the action plan itself, linked both in the video description and on our blog. Each of these objectives has a global target, which it aims to achieve by the year 2020. The first objective is to strengthen effective leadership and governance for mental health. This is the primary driver of the creation of effective policies and laws in society, which allow government influence into this aspect of the healthcare system. For example, the creation, updating, and maintenance of a national health policy. This also includes equitable allocation of resources and the aforementioned empowerment of people suffering from mental illnesses. By 2020, the plan aims to have 80% of countries update or have developed a mental health policy or plan, and for 50% of countries to have done the same with their laws. The second objective is to provide comprehensive, integrated, and responsible mental health and social care services in community-based settings. This covers patient-centered care, which focuses on assessing and understanding each individual's unique needs and goals, and covering both the mental and physical needs at all stages of life. Physical health plays into mental health, as mental and physical problems usually interact with each other, and can amplify each other's effects. The action plan also notes a need to be capable of handling vulnerable populations, whether socio-economically or those exposed to disasters and conflicts, and focus in on discrepancies that exist between these populations. By 2020, the plan aims to have increased service coverage and access to healthcare, particularly for worse cases of mental disorders, by 20%. The third objective is to implement strategies for promotion and prevention in mental health. This refers specifically to the promotion of awareness universally across sectors, private and public, to improve public awareness and knowledge, and improve intervention outcomes for treatments. This extends the plan to more than just those directly affected by mental illnesses, to the peoples in their lives. It also encompasses prevention of suicide, again focusing in on the vulnerable groups, and improving support. By 2020, the plan aims to have 80% of countries implement 2 or more mental health promotion and prevention programs, and to reduce suicide rates by 10%. The fourth and last objective is to strengthen information systems, evidence, and research for mental health. Simply, this means to have information about and indicators of mental health be integrated into the statistics of the health system, and be collected as any other statistics are. This also covers the general improvement of research, collaboration between health and educational institutes, and correction of the discrepancy between the amount of research in a more economically well-off country compared to a lower-income one, which, as one might imagine, is a matter which is quite dear to us here at Mental Health Different Wealth. By 2020, the plan aims to have 80% of countries be collecting and reporting a core set of indicators of mental health, to be reported to the WHO every 2 years. That about sums it up for the World Health Organization's Mental Health Action Plan. As I said earlier, the full plan is linked here and also on our blog post. We have also provided a more succinct brochure which summarizes a lot of statistics and information around the plan. Thanks for tuning in, guys.